Another big topic that we spend a lot of time talking to our clients about is, do we or do we not get antibiotics during labor in the event that the mom has tested positive for GBS, also known as group beta streptococcus. To be colonized with GBS is not the same as being sick with the bacteria, like if you have a UTI or you have an infection in your vaginal tract. It's not the same thing. It's just like you normally find bacteria on your skin, in your hair. And so during labor and delivery, it is recommended that we test for it, and the recommended treatment is antibiotics during labor and delivery in order for it to cross the placental barrier and get to the baby to prevent the baby from potentially incurring a respiratory infection upon delivery. However, this is a huge conversation that we have with our families because some people don't like antibiotics, and so the thought of getting antibiotics and then giving them to the baby is something that some families do really want to think about. Some families say, it doesn't matter what the risks are to me, I want my baby to have this protection. And some families don't really want that. So we sit down with all of our moms and discuss the difference between infection and colonization, the risks and benefits of antibiotics, and we let them choose. Sure, there are instances where if your water has broken for a long period of time where antibiotics are indicated because that barrier to the baby is gone. The protection between the world and the baby is now gone. So we say antibiotics might actually be indicated, but we still want it to be something that you understand why we're saying it's indicated, not just, oh, you need antibiotics, end of story. Which is, I know, a lot of the experience that moms feel coming from hospital deliveries. And so no matter what it is, whether we feel it is important for you to have it or it's definitely medically necessary, we still want you to be informed, and we still want you still have the right to say no. Even if we insist, you still have the right to say no, but we want to know that you trust us enough to know that if we're saying it's important, then it probably is very important, but we still want to have a shared responsibility and a shared informed consent over it.